Dr. Goodman, thank you so much for joining us today.
Yes, thanks for having me.
Yeah, we're going to talk about hormone replacement therapy, which I have many questions about.
Yes.
But before we get to that, can you tell us about your experience?
Yes, so I'm a gynecologist, so practiced for around 20 years now, and have a medical spa in Coralville, Iowa, that I came on full-time there about 2 years ago. And we've just recently started offering hormone replacement therapy through the medical spa.
Okay. And what exactly is hormone replacement therapy? I hear it all the time,
Yes.
but I don't quite understand it. So what is it?
Yes, so hormone replacement therapy, so or short HRT, basically is renewing or restoring your hormones to the proper balance for you.
Okay.
So testosterone, estrogen, progesterone all decline as we age, and that's when we start to notice some of those symptoms like brain fog, low mood,
Oh, yes.
sleep disturbances, weight gain, all that type of thing is sometimes related to our hormones being depleted.
Okay. I notice sometimes too that I'm not sick, I don't have a fever, but I don't feel good.
Yes.
Is that the same? Is that a hormone imbalance?
It definitely could be. So
Okay.
that's what a lot of women, obviously me treating women for so many years, would come in and just say, I just don't feel well. And we would try at that time to kind of pin it down, maybe run some labs or check this. But there wasn't a lot we could offer because at the time we believed hormone replacement therapy should only be given for a short amount of time, only to people who really needed it.
Okay. And I've also heard too that if you have a history of breast cancer in your family, you really shouldn't do this, but that's not the case anymore, correct?
Right. So there was studies back 20 years ago that now they're revisiting, and there's been newer studies since then. And basically what they've come up with is that hormone replacement therapy is actually very safe, and the minimal risks are outweighed by the great benefits.
Okay. Right. And I know a lot of women think, I just need to tough this out. This is just part of me getting older. I need to
Right.
tough it out, but not
Right.
true. Once again, not true. We
Not
don't need to
true.
just tough it out.
Right, exactly.
Yeah.
Now that we have these options, and there's a myriad of options, different ways you can replace hormones, that you don't have to just tough it out.
Yeah.
You don't have to feel poorly. You can do things to try to make yourself feel better symptom-wise and protect your health, because hormones also help protect your bones, your heart, and your brain.
Absolutely. And it's not one size fits all.
That's right, that's right.
Yeah.
For men and for women, there's different hormones that may or may not need to be replaced, and different things that we can do even to help, like supplements, weight management, things along those lines.
What's the first step someone should take if they feel like they're ready for hormone replacement therapy, or they know they foresee it coming in the future?
Yes, absolutely. So you can just contact us.
Okay.
So at Radiance Medical Spa in Coralville, Iowa, you can call, you can text, you can email. We can send you a little bit of initial information, but if you're ready to dive in, you can do a consultation with a lab draw. A comprehensive, individualized plan will be drawn up for you. You can choose to go forward or not, but sometimes just information is power.
What questions do you want your patients to ask?
Yeah, I think there's always lots of questions around HRT, and so I think people want to know that it is safe. They want to know what's the right mode for them. Can we do it in different ways? And so that's why we come up with a really customized, tailored plan to help our patients.
And there's no like time frame when you're on it. You can be on it for a short amount of time, a long amount of time. Is that correct?
That's correct.
Okay.
We used to think it was just women in menopause that got hormones for a short time.
Yes.
Now we know it's middle age. When you're starting to feel these symptoms, we can run some tests. We can check with your symptoms, your medical history, and come up with something that makes sense for well into your future years.
Premenopause, perimenopause, menopause, and even postmenopausal, you can help out with all of those.
That's absolutely right.
Wonderful, because I think so many, like I said, so many women just think they're going to suffer.
Yes,
And,
yes.
yeah,
I think we didn't know what we didn't know at
That's
the
true.
time. And
Yeah.
so now we know so much more, and even the FDA is coming on board, and so we really feel like this is going to impact women and men just tremendously.
Yeah. Anything else you would like people to know about hormone replacement therapy or Radiance Medical Spa?
Yeah, we have a team there. So myself, a physician, we have 2 nurse practitioners, we have estheticians, we have a whole group there to help you. And so we're trying to make more time available because we've been inundated with people wanting to come in and see us.
That's a good thing.
That is a good thing. So we're trying to create some more appointment times. So just call and we can get you worked in and answer all your questions.
Yeah, and don't be afraid to ask questions, right? There's
That's
no
right.
question that's really too stupid.
That's
because
right. We've heard them all.
Yeah. Once again, where people can get more information.
Yes, so call, email, or text Radiance Medical Spa in Coralville, Iowa, and we can help you out.
All right. Thank you so much, doctor, for being
Yes.
here today. Appreciate it.
Thank you.